Back to the show now. I'm sure there's a few of you already that have some strains and pains from working outside this spring. Well, if those aches and pains seem to last a little bit longer than they probably should, then it's time to seek professional help. We're happy to have with us this morning Dr. Christian Milioto from Western New York Pain Relief and Integrative Wellness Center. Doctor, thanks for being here.
Pleasure as always.
Well, let's talk about spinal and nerve pain, because there's different ways to treat those. But I want to talk about research-based medicine to start with here. How can this be used to treat these kinds of issues, and what is your stance on this?
Well, so I've had my practice for 8 years, and I've had the honor of working with thousands of patients that are anywhere from 8 years old with nerve damage from the moment they were born to people that were in wheelchair from stenosis, diabetes, or neuropathy. And one of the biggest things everybody always says is when they come in the office, they say, first off, I didn't know that you even existed until I saw your advertisement or a TV commercial, but I didn't know that there were therapies that you could do that could actually help somebody heal and provide long-term pain relief while reducing medications, injections, and surgeries. Research and evidence-based medicine has been around for a long time. I've simply niched myself into working on people who have acute and chronic, more moderate to severe cases, people with disc herniation, spinal stenosis, sciatica, balance issues or heaviness and weakness in the legs and neuropathy symptoms. And we use a series of treatments that can actually eliminate chronic pain, restore nerve function, and improve blood circulation to that damaged tissue, and actually help that person reduce and eliminate their medications or potential surgeries.
Yeah, there is a research-based medicine you talked about. There's also taking that research and putting some things into practice, which you have done. You do things a little differently, as you mentioned here.
Yeah, one of the biggest things I did was I immediately got myself certified in nerve and joint therapy. We are the only clinic in the area that's actually certified to perform spinal decompression, which is the most advantageous therapy a person can use for neck, back, or nerve pain with a 96% success rate. As far as our neuropathy treatment, many people are told you can't treat neuropathy. And we have about a 90% success rate in terms of pain relief and improvement in quality of life and function. But what we're using is we're using therapies that are designed to actually help re-educate the damaged nerve, give the person pain relief. We have the most advanced Class 4 medical laser, which has a specific treatment for any type of neuropathy, whether you've had cancer, chemo, radiation therapy, you're a diabetic, or it's coming from a nerve root from your neck or back.
Yeah, these are things too. I know you've shared some success stories in the past. Care to share an anecdote today with us about a patient who's come in, tried everything, and you helped him?
Yeah, so about a month ago, for the first time ever, I brought a patient on television. His name was Sal. And I had the honor of treating him and the honor of helping him. He was somebody who had 7 back surgeries. He was addicted to opioid medication and weaned himself off of it. He had a pain stimulator in his body. He had a pain pump in his body. And he was like that for 25 years until he met us. 3 months of treatment and we eliminated his back pain, his numbness and pain into his legs and feet. We improved his balance and strength. The reason why I brought him on was to show people somebody who really had been at an extremely bad point in his life and had gone through everything. And for those who are trying to avoid future surgeries or their first surgery, come in and see us. Come in for a consultation. Come to my educational seminar and see what it's all about to really take control of your life and not just rely on people telling you what to do without knowing what some of the side effects of these medication and injections are doing to our bodies in the long run.
Yeah, it's important to examine the other options out there rather than surgery or pills. It is your own body, for sure. I know you advocate that. We'll tell everybody how they can register for a seminar. He has one of those coming up here for Western New York Pain Relief and Integrative Wellness Center. They provide natural solutions to pain relief. Their office is located at 4415 Union Road in Cheektowaga. And for more information, give them a call today, 650-PAIN. Visit their website at buffalopainrelief.com and learn more about different types of treatments they offer. And they have a free seminar that's going to be held on Wednesday, May 15th at 1 p.m. You need to call to reserve your seat for that free seminar, again, coming up on May 15th.